many statistical tests. So you need to know about study design as well. Okay. Okay. So first of all, why is it this study design? Okay, I just take example. Other example. For example, you are going today. You are planning to go somewhere. Okay, for example, okay, let's say in Terengganu, you plan to go KTCC, for example. Okay, so first of all, what you need to do? From your home, you want to go to KTCC. What are you supposed to do?
Plan dulu yang apa nak ke mana.
Okay, so you plan, right? So you start the car, then you plan, and then you start the car, and then you go to the place that you want to go. Okay, so same thing in research. Okay, same thing in research. You must know the direction first. Okay, anything you need to know about your direction. Okay, direction. In research, of course, your direction is for you to answer your research question. Okay, a research question. So think of your research question. How are you going to collect the data? Okay, is it you're going to collect prospectively or retrospectively? Okay, so all this research question, it must match with your study design. Okay, must match with your study design. So there is no best study design. Okay, no best study design. The study design that can answer your research question, that is the best for your study. Okay, because sometimes, okay, for example, your research question is you are looking at the association of you are looking at the because you are in the medical imaging, right? Okay, so you are going to compare which one is better, which method is better. For example, CT scan and MRI, which one is better? Okay, so if that kind of study, maybe intervention is not the best design for you. Okay, because you just want to compare between these two methods. Okay, so the observational study design is the best for you. Okay, so it depends on the study. Okay, some study, okay, I want to compare, I want to know that this new drug, is it better than the old drug, than the current drug? Okay, then intervention is the best study design for that, to answer that research question. So the study design that can answer your research question, okay, may not be able to answer other people research question, right? Okay. So here today we are going to recognize the most common ways causal relationship or association are explored. Okay, for each study design, you will know about advantages, disadvantages, okay, strengths and weaknesses for each method. Okay, to answer a particular type of clinical question. Okay, so how do we begin to answer the question? Okay, we start same like we a building, okay, building house. Okay, same like the building house. You must have a good foundation. Okay, must have a good foundation. So same thing in research, must have a good foundation. So you must know what are the points that you need to think about. Okay, so for example, first one, you need to know about your participants. Okay, participants or investigation. Okay, who is your participant? Okay, are they from children? Are you going to take the data from the children, or are you going to take from the community? Okay, is it from human, or some people they do study on animal? Okay, is it at the lab? Okay, all right, is it just take from the retrospective by looking at the medical records, by looking at the like your medical imaging, you have your own record, right? The inside the radio department. So is it you are looking at that kind of record? So you must know who is your participant of the study. Okay, and then after that, your outcome. Okay, you know about participant, and then you need to know about your outcome. Okay, your dependent variable. What is your outcome? Are you interested to measure in numerical? Okay, for example, radiation. Is it in a numerical form? Okay, is it in the categorical form? Okay, so you must clear with your outcome. Okay, must clear with your outcome. Then you can proceed with your study. Okay, in the research question, when you formulate your research question, you must be clear. What is my outcome? Okay, is it my outcome? Is it a numerical or a categorical? Okay, who is my participant? How am I going to collect the data? Okay, how I'm going to collect? Is it prospective? Are you going to follow up patient, or you are just taking you just meet patient one time, you collect data and that's all, or you are looking retrospective. Okay, retrospective is by looking at the medical records. Okay, so you must ask yourself about this one. And then other consideration. Okay, other consideration. Okay, I make it as a short form, 5MT. Okay, 5MT. So what are the five? Can you give idea what is M? What is T? There are 5M and 1T. Can anyone give suggestion? What is M? What is 5M and what is 1T? Yes, money. Correct. No money, no talk, right? If you want to do research, you need money. If you don't have money, then you have to think the research that no need to spend money. Okay? And then what else? T, yes. T, time. Correct, time. What is money? What is M? Method. Yes, correct. Methods. Okay, method is side design also one of the methods. Okay, if you are doing a lab work, for example, okay, you have to know what method you need to use. Okay, so method, correct. And then another three.
Machine.
Machine. Machine also method, right? Or what is that? Material. Yes, material. Okay, material. Machine is one of the material, right? Okay, and then that's another two. Can you work alone when you do research? Manpower. Okay, you need manpower. That means even though, okay, like you have your final year project later, you have your you are going to do alone, right? But at the same time, you must have your supervisor. Some of you may need a co-supervisor. So manpower, you cannot work alone. Okay, and then one more is some people are good at this one. Market, no. Market, no. Okay, some of you are good at this one, but some of you are very poor in this one. So what is that?
Management.
Yeah, correct, Iman. Management. Okay, so management. You have to do management in terms of time management, financial management. Okay, like for you as a student, when you do your project later, your one semester, 2 semester, not solely on the project. You still have other classes to attend. You still have to do tests. You still have to do final exam. So management in terms of time. Okay, so that is very important. So 5MT is money, material, okay, methods, okay, manpower, and management. And of course, T is time. So that is a consideration before you start your study, before you can start actually create your research question. Okay, and then another thing is, okay, presence of a comparison group. Okay, comparison group, that means you will have two group. One group is a control group and another one is the one your interest group. Okay, but this is depend on the study. Okay, some study no need a comparison group. Okay, but why we need comparison group? To increase the validity of an observed association. Okay, for example, I give you example. I'm going to do an intervention study. Okay, intervention study. I want to know whether after 3 months, is it your BMI reduce after 3 months? Okay, I give intervention aerobic exercise for 3 months. Okay, first your baseline, I will measure BMI first. Okay, measure BMI, and then one group I give intervention. That means aerobic. Another group is a control group. Okay, control group maybe I just give a pamphlet not related to the BMI reduction. Okay, so and I give intervention. I give the aerobic 3 months. After 3 months, I measure again. Okay, I measure again. Intervention group I measure. Control group also I measure after 3 months. Okay, if you see there is a reduction of the BMI, okay, you can say that it is because you can conclude that it is because of the aerobic, because you have control group. Okay, control group another issue. Okay, so without any comparison group, okay, that means it is just based on the single group. You cannot conclude that it is because of the aerobic exercise that can reduce BMI. Okay, because you will not know at home in terms of diet, or at home they will take some kind of pills to reduce the weight. Okay, so that's why we need to add a comparison group. We need to add a control group. Okay, and then in terms of intervention, okay, we have the intervention and outcome must be measured with as little error as possible. Your exposure and outcome must be measured with as little error as possible. Okay, for example, you are taking even just a simple, for example, questionnaire. Okay, questionnaire. Okay, you give the questionnaire to the participants. Okay, if let's say the participant cannot remember, then it will have a recall bias already. Okay, for example, okay, you just without measuring any BMI, for example, you just take their, okay, can you write down what is your weight? If some participant, oh, I'm not sure, so it's a recall bias already. So there's an error there. So it must be measured with as little error as possible in the study. Okay. So this is actually a pyramid. Okay, this pyramid is consists of the study design. Okay, the common study design and in health sciences. Okay, I will explain. This is the summary of it. Okay, so we have the systematic review and meta-analysis, intervention for experimental studies, okay, such as clinical trials, community trials. We have under observational, there are two. One is analytical, another one is descriptive study. Okay, under observational, the analytical one can be divided into three main groups. And then under descriptive, we have the population one, we have the individual one. So I will explain one by one. Okay. Okay, we start from the bottom. Observational descriptive study. So, descriptive study. Descriptive is just describe. Okay, you just describe. Okay, describe. So, you just observe. Okay, just observe, no intervention. Okay, observational is just observe, no intervention. But the difference between analytical and descriptive is just describe. So that means for example, you are looking at your study, your research question is you are interested on prevalence and the associated factors of obesity, for example. Okay, so prevalence is under descriptive, because prevalence, that means just a proportion, so describe only. Okay, but when you want to do the associated factors of obesity, then you need to do a statistical test. Then that one fall under analytical study. So in one study, you can have both descriptive as well as analytical. Okay. For undergrad, usually observational is enough already, because in terms of time, you want to do intervention, is quite difficult for you. Okay. So under descriptive, if among the population, you can measure prevalence, you can measure incidence. Okay, what is the difference between these two? Prevalence and incidence. What is the difference? Prevalence, incidence. What is the difference? Prevalence is what? Prevalent is frequently confused. Meaning? Prevalence is probability of something to happen. That means not happen yet, is it? What about incidence? Prevalence of breast cancer. Incidence of COVID-19. Prevalence, okay, I will give the answer. Okay, prevalence is actually existing cases. Okay, existing cases, that means it's a combination of both old and new cases. Okay, it's a combination of both old and new cases. That is prevalence. Okay, incidence is actually new cases. Okay, incidence is new cases. Okay, I repeat, prevalence is a combination of both old and new cases, and incidence is a new cases. Okay, so if let's say you are interested on prevalence of breast cancer from the year 2010 till 2019. Okay, so it's a combination of old and new. Okay, so if that case you are interested on prevalence, what type of study design that you need to choose? Incidence of COVID-19. So that means a new cases. Okay, so what are the incidents? Okay, so what if let's say incidents, that means what type of study design that you need to choose? So both give you different study design. Okay, that one we will explain after this. And then there is population. Okay, if let's say individual, okay, for example in a ward, okay, it happened that you found out a new case. Okay, is maybe in overseas there is already, but in Malaysia, okay, this case is very rare and it happened in your hospital. So you can do case report on that particular patient. Okay, so that means it's individual, one person only. Okay, a case series is a combination. Okay, you can take, okay, oh, there are few cases happen already, so you do case series. So these two, the case report and case series, is not a full-fledged research. Okay, but it is actually a beginning of research. Okay, beginning of research. You can generate the hypothesis from there. Okay, that is the case report and case series. Okay, so any question on descriptive study? Okay, I proceed. So that is descriptive. Okay, now we go to analytical studies. So in analytical study, observational analytical study can divide it into three main group. Cohort study, okay, case control study, cross-sectional study. Okay, so the best for the observational study is prospective cohort study. That is the best study design under observational study. Okay, the best study design is prospective cohort study. Prospective cohort, that means look, you this is not happened yet. Okay, you follow up the patient. Okay, you observe only, but you follow up the patient. So if not happen yet, then this prospective cohort can measure incidence. Okay, if you are interested on incidence study, then your study design will be prospective cohort study. Retrospective. Okay, prospective, you need money, you need time. You don't have money, you don't have time, very difficult for you to do prospective study. You want to observe, okay, for example, you are interested to know, is there any association between smoking and lung cancer? Okay, you are interested smoking and lung cancer. So how do you know? To develop a lung cancer is not 1 or 2 days time, right? Okay, sometimes how many years? 10, 20 years to develop lung cancer. So if you don't have time, you don't have money to perform the prospective, then another option is you go for retrospective. Okay, by looking retrospectively. Okay, so retrospective, since it is disease already happened, okay, retrospective disease already happened, you just look back at, for example, folder, okay, medical records, okay, if let's say those who develop lung cancer, what are the factors that can contribute to lung cancer? Okay, so that is retrospective. Okay, for you, I will introduce only prospective and retrospective. Okay, historical, I will not introduce you. Okay, historical actually combination is a mix of these two, prospective and retrospective. But I will not introduce you the historical one. Okay, case control. We will go one by one after this. Okay, so case control. Case control, we can divide it into three also. Mesh, unmesh, and nested. Okay, but I will introduce you only unmesh. Okay, only unmesh. So, unmesh case control. Case control, the peculiar feature for case control is it is meant for rare disease. Okay, rare disease. Okay, prospective, retrospective, all are common disease, rare disease. So, for example, what is a rare disease now? Okay, so you can use case control study. So that is the peculiar feature for case control. Okay, and then we go to case cross-sectional study. Cross-sectional study is the most common. Okay, is the most common. Okay, it measure at one particular time. Okay, we have classical, we have comparative, we have diagnostic test, we have questionnaire. So that all this fall under cross-sectional study. Okay, diagnostic study. Okay, maybe for you the medical imaging. Okay, you have a diagnostic study. For example, you are looking at the which method is better. Okay, which method is better in detecting a brain tumor, for example. Okay, so you are going to do the diagnostic test between CT scan and MRI, for example. Okay, so you are going to come up with the sensitivity, specificity. Okay, then you will know which method is better in detecting the brain tumor. Okay, another one is questionnaire. Okay, in medical imaging also, your senior, I used to see they did on questionnaire. Okay, they about radiation, for example. Okay, they want to know the knowledge of about the radiation among students or among staff. Okay, so they use questionnaire. Okay, so that questionnaire, it falls under cross-sectional study. Okay, and then we have, this is observational group. That means you just observe. You are not giving any intervention to them. Okay. Another group is intervention study. Intervention study, that means you give something to them. You intervene them. Okay. You give. You want to measure, for example, I give example of community trial. Okay. You are looking at their improvement of knowledge. Okay, whether the health promotion can increase their knowledge or not. Okay, so you give questionnaire at the baseline. Okay, at the baseline, you want to see, you want to assess their knowledge level first. After that, you give intervention. What intervention you give? You give health promotion. You give health promotion. Health promotion, you give talk, you give pamphlet. Okay, so that is you intervene. That means you give something to them. Then after you give something, then you measure again their knowledge level. So that is fall under intervention study. Okay, whenever you give anything to the participant, to the patient, then that means you intervene them. It falls under intervention study. Okay, for example, clinical trial. Okay, you are looking at the you want to introduce a new drug. Okay, to reduce the hypertension. Okay, you have already current drug. Okay, but you want to see whether this new drug can actually reduce the hypertension better than the current drug. So that means one group you give the drug, another group maybe you give placebo. Okay, so you give them something, you intervene them something. That means you give the drug to them. Okay, if let's say you give anything to them, then it falls under intervention group. Okay, the first one, okay, this RCT is the gold standard. Okay, randomized control trial is the gold standard. Okay, we have another one is systematic review and meta-analysis. This one I will not introduce you. Systematic review and meta-analysis. Okay, this is actually since a trial is very expensive, okay, so people go for systematic review. So that means they will compile all the study that is that do on the trial. Okay, instead of they do one trial, they compile other people study on the trial on that particular topics. So that's why we call it systematic review. Okay, meta-analysis is actually synthesis of systematic review. They do the analysis on the paper that they collect. Okay, that then we call it meta-analysis. Okay, right. So this is just overview, okay, of the study design. Okay, I will explain detail one by one. Okay, is it okay? Can follow?
Okay.
Yes.
Okay.
Yes.
Okay. Right. Okay, so we start with randomized control trial, or short form is RCT. Okay, randomized control trial. So randomized control trial, okay, randomized comes from the word randomization. Okay, randomization. Okay, you will learn later random sampling. Okay, random sampling, that is different. Random sampling is you are selecting your sample from the population. Randomization is how are you going to allocate your treatment to the participant or to the patient, because this is intervention, right? So how are you going to allocate? Okay, this drug A and drug B, how I'm going to allocate to this patient? If this patient come, which drug should I give? Then that one we call it randomization. Okay, so randomized come from the word randomization. Control is you must have another group. Okay, you have the test group and you have the control group. Okay, so that's why control. So RCT, you must have element of another comparison group, and then you must have the randomization element. Okay, so RCT is a gold standard. Okay, is a gold standard because some study you cannot afford to do randomization. Okay, for example, you are going to compare, is it scope, okay, putting the scope, or by incision is better. So how are you going to do randomization? Because that kind of thing people can see already. Okay, so difficult to do randomization, right? So that's why RCT is the best, because some study you cannot afford to do randomization. Some study also you don't need control group. Okay, all right. Selection of groups entirely random. Okay, so in the this entirely random, that means you have the randomization element, you have also the random selection element. Control group identical to treatment group at start except for intervention. Okay, remember just now, because it's control, we have the control, you have the comparison group. So at baseline it must be identical. Okay, it must be identical. So that means there's no difference. If let's say you take you compare their age, there's no difference between these two. It is comparable. Okay. You take, for example, you are going to see the efficacy of the drug. Okay, so the blood pressure between these two group must be identical. Okay, cannot control group is lower to compare to treatment group. Then people can question your result later. Okay, another term for RCT is blinding. Okay, blinding. Blinding, that means the patient will not know that they receive what type of drug. Okay, then we call it single blind. If patient doesn't know, then we call it single blind. And then the researcher also doesn't know. So that means pharmacist, she prepared the drug. Okay, one is new drug, another one is placebo, for example. So these two drugs are similar. Okay, so you as a researcher, you also don't know what type of drug is that. So that one we call it double blind. Okay, double blind. If let's say you cannot afford to do blinding, no problem. Then we call it open label. Okay, the study that cannot do blinding, we call it open label. Okay, open label. Okay, so may evaluate good and bad outcomes. Of course, from RCT, okay, you got the result. Which one is better? Okay, which drug is less effect? Okay, so that is RCT. Okay, RCT. Okay, example, effectiveness of new antihypertensive drug. RCT can the randomized control trial can be divided into two. One is we call it parallel study. Okay, parallel study. Parallel study, that means from the population, you withdraw the sample and then you do the randomization. That means you do randomization, which subject under the test, which subject under control. Okay, so that is parallel. Okay, parallel study. Okay, so this is the example. Okay, so one group receive new drug, another group use usual drug. Okay, that is parallel. We have also, the parallel is actually a classical design of RCT, classical design. Another type of design is, we call it crossover design. Okay, crossover design. Crossover design meaning both will receive both will fall under test and also control. Okay, like this one. Okay, from the population, you withdraw a sample, you got the eligible subject already, you do randomization. Okay, so group A, okay, take the pre-treatment, take the baseline. Group B also take the baseline. Okay, and then both group A will receive new treatment, group B will receive placebo. Okay, after that, you measure again the post-assessment. Alright, and then we need to do washout period. Okay, because after that, they will swap. Okay, group B just now, group A just now will receive placebo, group B just now will receive new treatment. They will swap. Okay, so that means both group will receive both, but in a different time. Okay, so that's why need washout period. Okay, washout period, that means you clear the drug from your body. Okay, because, okay, for example, I'm in a group A, I receive new treatment. Okay, I receive new treatment. So after some time, finish already post treatment, then I will given washout period. So that means they will clear my drug, the new treatment inside the body. Then only I will receive the placebo. Okay, so same participant will receive both treatment. Okay, at different time. So for crossover, the important one, we need washout period. Okay, washout period. Okay, we call it, this is carryover effect. Okay, carryover effect. So need washout period. Okay, washout period, that means you want to clear your drug in the body, usually 2 weeks to 2 months. Okay, depend on type of drug interaction. Okay, so when we can do this crossover, when you have problem with your sample size. Okay, for example, sample size is very small, then you can do crossover. Crossover is a bit difficult, okay, in terms of the design itself, and also in terms of the analysis itself. Crossover is difficult. People tend to go for parallel study instead of crossover study. So what is the advantage of trial? Okay, what is the advantage of trial? Of course, trial, I said just now, is a gold standard. Okay, it's a gold standard. Okay, and then you will know the result. Okay, which one is better? So that is trial. But there's disadvantages of using this trial. You need money. Okay, because you want to prepare the drug, you want to prepare any assessment, you need money. Okay, need money, and you need time also. Okay, because you measure more than one time. You have the baseline, and then you do post assessment. Sometimes post assessment is 2 or 3 times, so time consuming. So that is disadvantages. And then sometimes because of many time measure, okay, patient will lost to follow up. Okay, patient come, baseline come, after give intervention, patient still there. Okay, after 2-3 times want to see, patient lost already. You cannot detect where is the patient. So that is the disadvantages of the trial. Okay, and then of course in terms of we have the carryover effect for the crossover study. That's why you need the washout period. Okay. Okay, that is RCT. Any question on RCT? Any question on RCT? No, huh? Okay, so far okay. Alright. So, can we continue or you want to take break for a while? We are going to do observational study. You want to take 5 or yes, you have question. Yes, Shasha. Crossover is done is when we have problem with sample size. Yes, sample size. Okay. When you have problem with sample size, you can do crossover. Okay. Why I said a sample size? Okay. If let's say you see this, this is parallel study. So parallel study, for example, parallel study, you have 30 per groups. So 30 will receive new drug, 30 will receive usual drug. Okay. But for crossover, okay, sometimes because 30 is quite a huge number to get a patient. Okay, 60 patients is very difficult to get a patient because this is trial, right? Some patient refuse. Okay, they don't give consent, so difficult to get a patient. Okay, if let's say like this, for example, you got 10 you will receive new treatment, 10 will receive placebo. Okay, 10 that means sample size is only 10. Okay, 10 will receive new treatment, 10 will receive placebo. After that, the same 10 will receive the placebo, the same 10 will receive new treatment. So that means you double it already. Okay, so that's why crossover. If you have problem with sample size, okay, sometimes your disease is very is not common, it is rare, okay, but you need to do intervention study. Okay, so alternative is by using crossover design. Okay. Yes, sample size, that means number of patient, number of participant. Sample size, that means what are the numbers of patient or participant or respondent that you want to take in your study. Okay, you will learn sample size after this. Okay, sample size, sampling method, you will learn. Placebo. Placebo is you have new treatment, you have drug A, okay? Drug A, and then you want to compare with another drug, okay? The current treatment, okay? Current treatment. So the pharmacist will make it similar. Okay, for example, blue color. So both are blue color. So the current treatment, we call it placebo. Okay, placebo, not the drug that you want to test, not your drug interest. Okay, that is the term. We call it placebo. Is it okay, Sasha? Okay. All right. Others, do you have any question? Okay, we can continue, or you want to take break 5 minutes? Patient loss. Yes. Disadvantages of RCT is patient loss. Okay, patient loss to follow up, meaning like this. Because this RCT, you need to measure more than one time. Okay, 2 and more. Okay, you are going to test the, for example, like this, you are going to test the whether this new drug can reduce your hypertension or not. Okay, reduce the blood pressure or not. Okay, baseline, you measure their blood pressure. After that, you give the new drug, you give the usual drug. Okay, this time patients still come, right? Patients still come. Patient come for baseline. Patient come when you give drug, because drug cannot give one only, right? You need to give many times. Then you can see whether is the effect or not. So give new drug. After that, measure again. After that, patient fed up already because need to come to hospital every time. And then sometimes they see, oh, I already got the effect. My blood pressure low. I don't want to come anymore. So patient lost to follow up. Okay, your study required 4 times, for example, measured. Okay, but patient only come 2 times, so another 2 missing. So how are you going to analyze the data, because not complete, right? So that is the disadvantage of RCT. Patient lost to follow up. You cannot trace the patient. You call patient also, patient did not pick up phone. They don't come to your research center, right? So that is patient loss to follow up. All right. Okay. Okay. Any other questions on RCT? Okay. If no question, and then take break for what or how?
Continue.
Continue. Okay, so we continue. So I'm going to just now is the intervention. Okay, intervention, and then this I'm going to explain now is observational study. Okay, intervention, like I said just now, you give something, right? You intervene them. Okay, observational, that means you just observe. Okay, observe. You are going to see association between smoking and heart disease. Okay, that means one group is a smokers, another group is non-smoker. You don't tell them, okay, for you, please smoke. Okay, I give you cigarette, please smoke. Another group is don't smoke. Okay, you don't say that. You just observe them. You take a group. One group is those who are really a smoker. Another group is non-smoker. You just observe them. Just observe till they develop the heart disease. Okay, so that is observational study. Nadira, what is control and test on the parallel chart? Is it a group of people? Okay. Okay, sorry, we explain this one first. Okay, this one, test and control. Okay, test and control, that means this one. Test is a new drug. Okay, and the control is the current drug or placebo. Also, that means test is the one that you are interested to look at. Okay, test is, for example, I'm going to, if let's say community trial. Okay, my interest is I want to know whether my health promotion is it effective in increasing the knowledge of participants. So my test will be the health promotion itself. Okay, the control group, so I give something else not related to the topics. Okay, so the test is your interest. Okay, your interest under study. So what you are intervene them. Are you going to give drug, or are you going to give in terms of health promotion, or are you going to give are you going to for example incision and also by giving by putting the okay, sometimes for example you do you are going to, you have the appendix, right? Okay, appendix, you do appendectomy. Okay, so some last time you have to scissor, right? Okay, now just do a hole, just do a small incision only. So which one is better? Okay, so that kind of thing. So what is your interest? Okay, that is a test. Okay, control is your the current one. Okay, for example, you want to know whether CT scan and MRI, which one is effective. Okay, you are going to do intervention. Okay, one group receive a control, one group receive CT scan, and a group receive MRI. Okay, you are going to give something, maybe a drug, okay, through CT scan, and then the drug through MRI. So which one is better? Okay, something like that. Okay. Nadira? Okay, can I continue? Okay. So, all right. So under observational study, there are 3 study design that I will introduce you. 4 study design I will introduce you. Prospective cohort, retrospective cohort, case control study, and the last one is cross-sectional study. Okay. So, what is cohort? Prospective cohort. We go to cohort first. Okay, cohort. Cohort, prospective cohort, okay. Cohort is actually a group of people. Okay. Prospective, if let's say prospective cohort, none of them experience the outcome of interest. Okay, because prospective that means, okay, for example, smoking and lung cancer. Okay, smoking, lung cancer not happen yet. Okay, lung cancer not happen yet, so you just observe these smoker and non-smoker. You just observe them till they develop the lung cancer. So they don't experience the outcome of interest. They don't experience the lung cancer yet. So that is prospective cohort. Okay, prospective. Since they don't develop the interest yet, they don't develop the outcome yet. That's why prospective cohort is the study design that can measure incidence. Okay, the only study design that can come up with the incidence is under prospective cohort. Okay, under prospective cohort. So on entry, people are classified according to characteristics that might related to outcome. Okay, so on entry, you just take one group of patient take smokers, another group is non-smoker. Okay, so their characteristic is you have from the literature, you have an idea already. Okay, smoking can relate to this cancer. Okay, so you take smoker and non-smoker group. So you observe them. Okay, so that means on entry, the characteristic might be related to the outcome. Okay, and then you observe them, so that means they haven't experienced the outcome of interest. So other name for prospective cohort, we can say that is a longitudinal study. Okay, prospective study, incidence study. Okay, because this is the only study design that can give incidence. Okay, the special feature for prospective is give incidence. Okay, Let's see the diagram. Okay, diagram. Okay, exposed, unexposed. Okay, exposed, unexposed. For example, smoker group and non-smoker group. Okay, so you observe them. You observe smoker group. Are they develop heart disease or no? You observe unexposed. Are they develop disease or no? Okay, so direction is to the future, because remember, disease not happen yet, right? So direction of inquiry to the future. So where are the researcher? Where are the researcher? Okay, researchers is actually in the middle. Okay, researcher is in the middle because remember, you observe them. Okay, you observe them. So you are in the middle here. In the middle, that means you just observe them. Okay, exposed group. How many they develop disease, how many not develop disease. You just observe till they develop the disease. So the researcher is in the middle. Okay, looking in future. Okay, you are looking, the direction of inquiry is to the future. Okay, so you okay? Right? Since the prospective can give incidence, okay, the risk assessment, okay, it can measure relative risk. Okay, it can measure relative risk. Okay, relative risk is the true risk, is the best risk. The original risk is relative risk. Okay, but relative risk come from incidence. So the only study design that can give incidence is prospective. Okay, so prospective can come out with relative risk. Okay, so relative risk. Relative risk, okay, for example, okay, incidence of, incidence of heart disease among smoker. Okay, incidence of heart disease among smoker. I'm telling you how to calculate a relative risk. Okay, incidence of disease among smoker, and then divided by incidence of disease among non-smoker. Okay, so you divide these two, become relative risk. Okay, relative risk, RR. Okay, incidence of heart disease among smoker divided by incidence of disease among non-smoker. We call it relative risk. Okay, is the actual risk. Okay, so how to interpret this relative risk? Okay, you got the relative risk 2. Okay, what does it mean? Okay, relative risk is inside your notes. Okay, this one after that I explain. Okay, relative risk equal to 1. Okay, relative risk equal to 1. That means no risk. Okay, no risk. That means you can say that there is no risk effect between smoking and heart disease. Okay, if you got 1. If you got less than 1, relative risk less than 1, for example, 0.25, you got your relative risk 0.25. So what does it mean? How to interpret 0.25? Okay, smoking are lesser risk to get heart disease. Okay, smoking are lesser risk to get heart disease. So that means you can say, oh, come, smoke, because if you smoke, you don't have risk to get, you have less risk to get heart disease. It become protective. So you ask people to come and smoke. Okay, that's what it mean by less than 1. If more than 1, there is a risk effect. Okay, more than 1 has risk effect. That means smoking are higher risk to develop heart disease. For example, relative risk is 2. So smoking are 2 times higher risk to develop heart disease compared to non-smoker. Okay, you got the result, relative risk is equal to 2. That means smokers are 2 times higher risk to develop heart disease compared to smoker. So that's what it means by relative risk. Okay, odds ratio, after this I will explain. So relative risk, remember relative risk come from the incidence. So this is the one that I mentioned just now. Okay, the one I mentioned just now. Okay, from the incidence. Okay, from the incidence. So incidence of heart disease in smoker group divided by incidence of heart disease in non-smoker group. Then we call it relative risk. Okay. All right. So far, okay for relative for prospective.
Okay.
Okay. So prospective cohort is the advantages of prospective cohort is prospective cohort can give incidence. Okay, can give relative risk. Okay, since disease not happen yet, so you can get incidence, you can get the relative risk. But these advantages of a prospective cohort is time consuming. Okay, you need time, you need money. Even though just observe, you still need money. You need to have manpower, many manpower. If you are a researcher alone, you need to observe the heart disease to develop 20 years, for example. How can you work alone? Okay, sometimes the researcher die first. Okay, study still going on. You work alone, right? So you need manpower. That is disadvantages of prospective cohort. Okay, even though it's the best, but people cannot afford to do. Okay, because of time, because of money, because of you need a research team to you need a proper research team to do this prospective cohort. So because of that, people go for other alternative that is, we call it retrospective cohort study. Okay, retrospective cohort study. Okay, retrospective cohort study or retrospective record review, because most of the record review are by retrospective cohort study. Okay, retrospective record review, triple R. Okay, wait, somebody asked question. How to do the observation? Is there any method to do observation? Observation is just observe only. No need any method. That means you just observe them. They smoke. Okay, just observe them. Okay, they how many box of cigarette they smoke. Okay, you observe till they develop. That's all. There's no any method. Okay, you just observe them only. Okay, maybe you can just take, okay, if you want to take other thing, for example, demographic, of course you need to take. Okay, maybe you just, usually observation is just observe, doing nothing, observation only. Okay, that's why you need time. Okay, there's no any method, okay, to do observation. All right. Yeah, so we have the since prospective is time consuming, money, and then you need manpower, then we go for retrospective. That is the alternative. Okay, they try to imitate the prospective cohort. Okay, this retrospective, disease and exposure happen already. Okay, so where are you? Okay, where are the researcher? Okay, so same thing, expose, okay, develop disease or not. All right, so it seems like prospective cohort, but where is the researcher? Researcher is at the back here. Okay, researcher is at the back here because disease, okay, disease and exposure happen already. Okay, disease happen already. Okay, retrospective, disease happen already. You just observe them, okay, by looking at the okay, for example, record review. Okay, you are interested to know the smoking and heart disease, so you go to the hospital, you ask the permission, get the ethical clearance. Okay, request from the medical record. Okay, I want a medical record. That means the medical ward. Okay, so from the medical ward, you got the you got the whether heart disease or not. So you filter because they have the diagnosis, right? So you filter. Okay, so this is the one that who developed the heart disease. Okay, then who developed heart disease. So from there, you will see their notes. you will see the medical record. Okay, oh, they are smoker. Okay, this person are smoker. Okay, then you take the you jot down. After that, you see again the medical record. Okay, but this person are not smoker. So that means you're looking at the record review only. Okay, record review only. Because this has happened already, so you just go and look at the record review and look whether are they exposed or not. Okay, because of you don't have money just now, right? You don't have time just now. So by looking at the record review, you save a lot of times. And then you don't need many people to do that. You get just go to the record review. Nowadays, record is you can see all online, right? So from the system online, you can filter already which one is heart disease, which one is who have the exposure or without exposure. Okay. So of course, in terms of the advantages for retrospective is you can overcome. Okay, you can overcome your time. You can overcome in terms of your cost. Okay, in terms of your cost. But there's a disadvantages if you use retrospective. Since disease happened already, you cannot measure incidence for retrospective. Okay, cannot measure incidence. You remember incidence is a new cases, right? So this one is happened already. So you cannot measure incidence. Cannot measure incidence, automatically you cannot measure relative risk. Okay, so what type of risk that you can measure? You can measure odds ratio. Okay, you can measure odds ratio. Okay, odds ratio is the estimate. Okay, estimate of relative risk. Okay, odds ratio is not a true risk. Okay, relative risk is a true risk. Okay, odds ratio is an estimate of the true risk only. Okay, estimate only. So that's why odds ratio sometimes is larger. The value is larger compared to relative risk because it's estimate only. It's not a true risk estimate. But that is the disadvantages of doing the retrospective cohort study. Since it cannot measure incidence, it cannot measure the relative risk, so it can measure only estimate of risk. That is odds ratio. Okay, that is odds ratio. So interpretation of odds ratio is the same thing also. Okay, interpretation same as relative risk. Okay, in terms of OR equal to 1, no risk. Okay, less than 1 is a protective. Okay, more than 1 is risk effect. Okay, only thing is when you want to interpret, okay, you cannot interpret that higher risk because this is not a true risk. Okay, how to interpret? For example, odds ratio you got 3. So smoking is higher chance. Okay, 3 times higher chance to develop heart disease compared to non-smoker. Okay, higher odds. Okay, you can put higher odds, higher chance, but don't use higher risk because risk is for relative risk, for true risk. Okay?
Okay.
Okay. Okay. Okay, so are you clear with the prospective cohort and retrospective cohort? Clear?
Yeah, doctor.
Okay, good. Okay. All right, now we can proceed with this is how to calculate relative risk only. Okay, how to calculate relative risk only. Right, so this one I will not introduce you. This is the formula only, okay? Okay, right, so we go to case control. Okay, case control. Case control, special feature for case control is for rare outcome. Okay, rare outcome. Okay, prospective cohort, retrospective cohort is for common outcome. Okay, common outcome. But when disease is rare, so how you may ask me, what does it mean by rare? Okay, that means it's according to statistics. Okay, the disease is very rare. That means the percentage is very low. Okay, now if you talk about COVID-19, okay, it's no more rare. It's common already, right? Okay, if let's say you talk about, for example, H1N1, that one may be rare nowadays. Okay, not many cases on H1N1. In 2010 last time, when H1N1 cases gone up, so that one become common. Okay, but now is this H1N1 may be rare already, so you can say it's rare. So it depends on the statistics. Okay, if you talk about dengue, dengue is common already. Okay, and you talk about, for example, malaria. Okay, malaria in Malaysia may be rare, but in certain country, is a common disease. So case control is for rare disease. Okay, for rare disease. That is a special feature for case control. So case, okay, case is with disease, control is without disease. Without disease, that means is clean, clean disease. Okay, clean. For example, you are taking on the psychiatric disorder. Okay, one is with schizo, for example, schizophrenia, right? One case. But another one is you take another psychiatric disorder. Okay, cannot, because it must be clear of disease. Okay, if let's say both of psychiatric disorder, then it's not, control is not like that. Control is must be clear, clean disease. Okay, so that means you need to take somebody who is without any psychiatric disorder. So case control, difficult part is this one: how to get the control, how to get the clean control. Okay. Okay. So case control. Okay, case control is looking back in nature. Okay, is something like similar to retrospective. Okay, because this one, case control, disease happen already. Okay, disease happen already. So you cannot measure the risk directly. Okay, cannot measure disease directly. So when you cannot measure disease directly, that means incident you cannot take, relative risk also you cannot take. Okay, you cannot measure the relative risk. So what you can measure? Okay, you can measure the odds ratio. Okay, you can measure the odds ratio. Okay, let us see the diagram. Okay, the diagram is, all right, remember, prospective, retrospective, you are interested on the outcome. Okay, outcome. That means from the exposure, non-exposed, you see the disease and no disease. But for case control, you start with the case and with the control. You are interested on the exposure. Okay, you are interested on the exposure. Okay, so that is different. So where is the researcher? Okay, the researcher is here. Okay, happen already. Researcher just observe from case how many are exposed, how many are unexposed. From control group, how many are exposed, how many are unexposed. So that is case control study. Okay, case control study, as I said, case control study can measure only odds ratio. So that is the risk assessment for case control. That is odds ratio. Okay. Alright, so this is this is about odds ratio. Okay, this is how to calculate odds ratio. Okay, odds ratio. Calculate odds ratio. Very simple actually. Just cross AD divided by BC. But I will not explain you about this cross section about odds ratio calculation. Okay. This one is actually you have different topic, but not at your level. Okay. Because your level is only basic statistics. So this one is maybe under epi, okay, under epidemiology. But I'm not sure in your course you have epidemiology or not. Okay, so this is not under this topic. Okay, so so far okay. Any question?
So far, okay.
Okay, good. All right. So that is, you learn already prospective. Special feature is prospective is common, and then for common disease, and then can measure incidence. Okay, all right, can measure, since we can measure incidence, can measure relative risk. Retrospective, to imitate prospective, because prospective need time, need money, so prospective can overcome that money and time problem. Okay, so prospective, since disease happen already, you cannot measure the incidence, you cannot measure the relative risk, so you can only measure odds ratio. Okay, both are for common disease. Okay, when you have a rare disease, you cannot use these two design. You need to use the case control study. Okay, case control study interested in exposure. Okay, cannot measure incidence also. Then you can only measure odds ratio. Okay, now let us go to cross-sectional study. Cross-sectional study, sometimes we call it correlation study. Okay, okay, just a correlation study only. Okay, just now you know from the other three study design, prospective cohort, you will see, okay, is this smoking can cause heart disease or not? So you can see the causal relationship there. But in cross-sectional, cannot. Cross-sectional is only association, okay, correlation between exposed and also disease. Okay, so in correlation, in the cross-sectional study, okay, you must know your defined population, take the sample. Okay, so this is cross-sectional study. Cross-sectional study, remember, we have two, right? One is descriptive, another one is analytical. Okay, cross-sectional study, okay, observe at one particular point in time or over a period. Okay, exposure and outcomes are measured at the same time. Okay, information obtained from subject only one time. Okay, let me, for example, questionnaire. So you just go observe, you just give questionnaire to the participant, you measure one time only. Okay, then I said two types. Okay, one is descriptive. Okay, cross-sectional study, the special feature for cross-sectional study is you can measure prevalence. Okay, you can measure prevalence. Incident just now, prospective cohort, right? For prevalence study is you by using cross-sectional study. Okay, for prevalence, point prevalence and also period prevalence. Point prevalence, that means at one particular time. Okay, I want to know the prevalence of lung cancer in 2010 at one time. Period prevalence is, okay, I want to know the prevalence of lung cancer 2010 till 2020. So that is period prevalence. Okay. So point prevalence is more specific. That's why people go for period prevalence. And then we have analytical. Okay, we have cross-sectional, we have comparative cross-sectional. Okay, so like this one. This is a classical cross-sectional. Okay, comparative, that means you have two population. Okay, you have two population. Comparative, that means you have different population. Okay, for classical cross-sectional, from the one population you withdraw a sample. Okay, comparative, you have two or more population, you withdraw a sample from each population. So there is a comparative cross-sectional study. So this cross-sectional study, you cannot measure risk assessment. Okay, you cannot measure risk assessment. Okay, because this is just correlation. You just want to see association only. You cannot say heart disease. You cannot say that smoking has higher chance to develop heart disease. Okay, you can only say that smoking, there's an association between smoking and heart disease. That's all. Okay, cross-sectional is quite limited. Okay, but this is the only study design that can measure prevalence. Okay. All right. So this is some of the example of the prevalence and also analytical study of cross-sectional. Okay. So this is the summary. okay, of the observational study design. Okay, prospective cohort. Okay, prospective cohort, we can measure relative risk. Okay, retrospective cohort, okay, you can measure odds ratio. IRR is incidence risk ratio. Okay, never mind, just ignore IRR, just remember OR only. Okay, odds ratio. Case control also can measure odds ratio, but for cross-sectional study, no, you cannot measure any risk assessment. Okay, so this is a summary of the observational study design. Okay, so I give you another flowchart. It's a guide to select an appropriate observational study design. Okay, so start with outcome. Do at the outcome first. Is the outcome rare or common? If let's say outcome is rare, then you know already. If rare, automatically is case control study. If common, you ask yourself again, are you interested on risk? Are you interested to measure the risk? If you are not interested to measure risk, then you choose cross-sectional study. If you're interested on risk, you ask again yourself, do I have enough money? Do I have enough time? Okay, if you don't have enough money, that means if you have no constraint in terms of time and budget, that means you have a lot of money, you have a lot of time, then you go for prospective cohort. But if you have limitation in terms of time, in terms of budget, then you choose retrospective cohort. Okay, so this is a summary how to select the appropriate observational study design. Okay. Any question?
Doctor,
Yep.
can you repeat the cross-sectional punya sebab tak berapa clear?
Okay, cross-sectional study. Okay, cross-sectional study. The feature for cross-sectional study is, the special feature is you can measure prevalence. Okay, cross-sectional study can be divided into two. Okay, descriptive as well as analytical study. Okay, descriptive. Okay, for descriptive, that means you can measure prevalence. Prevalence can be divided into two, point prevalence and also period prevalence. Okay, you are looking, for example, I'm interested to know the prevalence of heart disease in March 2010. So point, at specific point. Okay, if let's say because specific point, sometimes people are not interested, or it is too stringent, then you go for period prevalence. So that means, okay, I'm interested to know the heart disease, prevalence of heart disease between 2010 to 2020. So it's a period prevalence. Okay, that is descriptive part. That means just want to know the prevalence. Okay. In one study, okay, because prevalence is very simple, okay, very simple, just a descriptive. So in one study, people will combine descriptive as well as analytical. Okay, prevalence. Your topic is prevalence and associated factors of breast cancer in Terengganu. Okay, among women in Terengganu, right? So one part is the prevalence. Your study design will be cross-sectional because one part is a prevalence. Okay. Another part is analytical because you are looking at the associated factors of breast cancer. Okay. Analytical meaning you are going to perform a statistical test. Okay. Perform a statistical test. Okay. Prevalence no need statistical test because this is just a proportion. Okay, no need any statistical test. But analytical, to get the associated factors, you must have a statistical test. That one fall under analytical study. Under analytical, we have a cross-sectional, we have a comparative cross-sectional. Cross-sectional is a classical one. So that means, for example, your population is women with breast cancer. Okay, so you cannot afford to take the whole Malaysian, for example. So you withdraw a sample. Okay, you calculate sample size. Your sample size said that, okay, you need to take 200 patients with breast cancer. So from the whole population, you withdraw a sample. Okay, that means that is your sample size, 200 of them. And then you will measure, okay, the prevalence. Okay, so if prevalence, you need to take a woman. Okay, for example, all women, how many of them in Malaysia? After that, you withdraw a sample. So from that sample, 200 of them, so you will see, okay, which one has breast cancer, which one is without breast cancer. Okay, you take those who are cancer, but you divide again. Okay, which one is breast cancer, which one is not the breast cancer. Okay, so how many of them are breast cancer? Though that is become prevalence. Okay, so from there, remember this disease is breast cancer, this one is without breast cancer. Okay, and then from there, you will, maybe you can use questionnaire, or by looking at their record, okay, what are their exposure to develop the breast cancer. Okay, for example, okay, or she is not smoker, but husband are smoker. Okay, and then in terms of maybe not married. Okay, and then because of eating a lot of junk food, for example. Okay, and then okay, their exposure, what else? Okay, older age, for example. All right, and then maybe there are many other factors, right? Okay, so you collect from there, then you will analyze. So that's all for observational study. Okay, if comparative, you will have two population. For example, you are going to I'm interested to know job stress. Okay, job stress among nurses, and what are the associated factors of job stress among nurses and doctors. Okay, so you have two population. One population is nurses, another population is doctors. So you withdraw the sample from them, from there. Okay, population meaning, what does this population? Population meaning your study later, you want to infer back to the population. You cannot afford to do the whole Malaysia. Okay, or for example, the whole Terengganu, you cannot afford. So you just take specific from the HNZ, for example. Okay, so your sample will be from the HNZ only. Okay, so one nurses, another group is doctors. So same thing. Okay, you observe. Okay, what are the possible factors of job stress? For example, night shift. Okay, so you take by questionnaire, or by interview them. Okay, so that is the cross sectional study. Is it okay?
Okay, faham.
All right.
Thank you.
Okay, so others, do you have any other question? If no question, then I have question for you. Do you want some exercise?
Yes.
Yes, huh? Right, let's see. Okay. Can you see the PowerPoint?
Yes, that's okay.
So this I think 15 questions on the study design. Okay, let us see the first one. Okay, this is the scenario. This is your give example. Okay, this is the what you are interested. Can you tell me what type of study design? The percentage of smoking among female adolescents in the country in 2019 was determined. So what type of study design? Cross-sectional.
Cross-sectional.
So what type of cross-section is this?
Prevalence, point prevalence.
Point prevalent, right? Because at 2019. Okay, so this is just a descriptive cross-sectional study. Okay, you are looking at the prevalence. Okay, second one. Okay, a study was designed to determine if use of IUCD. Okay, this is intrauterine contraceptive devices. Okay, those who have difficulty in pregnancy, okay, they can try using intrauterine contraceptive. This is contraceptive method. Okay, this is contraceptive method. Okay, contraceptive method. Some people take pills, some people implant, some people injection. Okay, so this is one of the method. And then associated with PID. Okay, if you use, because this you need to put inside your uterus. Okay, is it associated with getting this disease or not? Okay, pelvic inflammatory disease. Okay, so participants were selected according to the presence or absence of PID. Okay, contraceptive method used for the previous 2 years was then determined for each participant by an interview. So what study design is this? You are looking at the association between the usage of IUCD and PID. What's the design?
Comparative cross-section.
Why you say comparative? Comparative meaning you have two separate population.
Go. Sekejap.
Yes. Yes, anyone? Oh, sorry. Retrospective cohort study. Case control. Okay. If you want to know case control, PID, is it a common or rare? Okay, if let's say PID is rare, then you can use case control. Okay. If not, yes, retrospective also can. Okay, retrospective record review also can. Okay. So like this one. Okay, PID is rare, then you can use case control study. Okay, case control study. All right. Next one. All right. So a study is designed to determine if use of IUCD cause UTI. Okay. Just now is PID. Okay, now UTI. And then UTI is urinary tract infection. Okay. After that, both groups are then followed to determine the development of UTI during the next 3 years. What study design? Yes. Okay. The keyword is here. Development of UTI during the next 3 years. So it's a prospective cohort study. Okay. Next one. To determine whether tubal sterilization is safer when performed by interns or medical officers. Okay. An investigator randomly assigned women requesting sterilization to 2 different groups. He then obtained information on any complication occurring in the participants during the 42 days following surgery. What study design is this? You have two groups. Okay, two groups. One doing by interns, and another one is my medical officer. Do you understand what is mean by this one? Tubal sterilization. A woman who doesn't want to get pregnant anymore, they sterilize the fallopian tube. Okay. One is performed by interns, another one is by medical. So you as a researcher, you randomly assign them. Okay, this woman receive the will do by the interns, another one receive by another one will do by medical officers. Okay. Yes, this is randomized control trial. Okay, the keyword is randomly assigned. Okay, keyword here. Right, so this is RCT. Okay. Okay, next one. A study was designed to determine prognostic factors of cancer of the pancreas. Okay, clinical and biochemical parameters were collected from medical records of the patient. Survival time of the patients was determined. Alright, what study design is this? Anyone? What study design? Yes, you can see the keyword there. From medical record. So it's a retrospective cohort study. Okay. So if you want to investigate association between smoking status and socioeconomic status, this one very easy. What is this? Yes. Oh yeah, correct. Observational, correct. So what is observational? Under observation, there are 4 of them. So this one fall under which one? Yes, it can be cross-sectional study. Okay. Prospective. No, this is not prospective study. Okay, you just want to see association between smoking and also socioeconomic status. Okay. So this is just a cross-sectional study. Okay, cross-sectional study only. You don't have any follow-up here. Okay, there's no keyword of follow-up here. Okay, so this is just one-time measure only. Okay, it's a cross-sectional study. Okay, next one. Effectiveness of an intervention program on weight reduction. So you want to compare, your interest is want to compare mean weight reduction between intervention and control community. So what study design is this? Yes. RCT. Okay. Sorry. Can you randomize? Okay. Randomization. This is among community in community. Okay, this is community. Randomization a bit difficult in community. Okay, community randomization is difficult because community because the keyword here is community. Okay, community. RCT, randomized control trial, RCT is based on individual. Okay, that means you can allocate them. Okay, patient A come, you go to drug A. Patient B come, you go to this drug. Okay, allocate individually. But when it comes to community, you go to your operational study is community, right? Okay, for example, school. Okay, how can you from the same school you cannot divide it, one group receive intervention, another group receive the control one, cannot. Okay, inside community you have to take the whole community as intervention. For example, school A as a receive the intervention, school B receive control. Okay, you must do community different. Community is based on the community. Okay, based on the group. Right? So RCT cannot be done. Randomization a bit difficult in a community. So because of that, you can just say that this is a community trial. Okay, community trial, or we can say it's a non-randomized control trial. Okay, a trial that cannot do randomization, we call it quasi-experimental study. Quasi-experimental study. Okay, a study that you cannot do randomization, we call it quasi-experimental study. Or you can just, because this is community, you can say that this is a community trial. Okay. Alright, this one. Number 8. Okay, invited statistician would like to know whether his input on the workshop was effective in understanding of statistical methods in research. Questionnaire given before, after that, followed by post-workshop. Okay, assessment using scores in numerical. So that means before start the workshop, I give you the questionnaire first. After that, I give you lecture. Okay, I give input. After that, at the end of the workshop, I give you the same questionnaire to answer. Okay, I want to know whether the input in the workshop do you have any improve or not in terms of your understanding of statistical methods at the end of workshop. So what say designs this?
Intervention.
Yes, it is interventional study, right? Because he give you the input of the workshop. So you give something, intervene, right? So this is under interventional study. So how interventional study correct? Is it RCT? How many groups here? Do you have intervention and control group here in this situation? Or you have only single group?
Single group.
Single group only, right? So that particular group measure the baseline, give the input, measure again the post. So only single group. So RCT RCT must have control group, right? So this is just a interventional group, single group. Okay, a single group only. Some people they mention it pre and post study. Okay, you can also say like that, right? And then, all right, researcher would like to investigate the contributing factors of obesity among Malaysian adults. A questionnaire was validated and an interview was conducted among 50,000 Malaysians aged more than 25. So what is the study design here? Contributing factors of obesity. Obesity is a common disease, okay, common health problem, so cannot be case control. And then using questionnaire only. So what study design? Yes, cross-sectional study. Okay, cross-sectional study. Number 10, a primary care physician assesses the smoking behavior before and after intervention program or anti-smoking campaign. Okay, so adolescents from secondary school were recruited to this program. Smoking behavior was assessed as present or present. Just now, the statistician one, the input, the measurement is by numerical. Okay, before and after the workshop. This one is, they have the anti-smoking campaign. So before, they ask first, assess first, are you a smoker or are you not? After that, they give the anti-smoking campaign. And then, ask again, are you still a smoker or no more? So what say design is this?
Intervention.
Yeah, this is same thing, interventional study. Okay. Also, you have a single group also. Okay. Okay. 11. Okay, this one is a researcher would like to determine the sensitivity and specificity of CT scan by comparing to MRI finding in diagnosing brain tumor. Okay. MRI was considered to be a gold standard. Okay, patient with brain tumor were recruited and both procedure were performed to each patient. Okay, this is you just get the result from the CT scan and MRI. You compare between these two results, get the sensitivity and specificity. So what study design is this?
Comparative cross-sectional.
Comparative. Okay. You can comparative is two population, two and more population. This is you have only one single proportion. You have single population only. You have only patient with brain tumor. Okay, but this patient with brain tumor, you use CT scan, use MRI. You got the result CT scan, you got the result MRI, you compare. So what's the design? This is just a classical cross-sectional study. Okay, not a comparative, just a normal classical cross-sectional study. Or we call it diagnostic test. Okay, just now at the beginning, right, I mentioned diagnostic test. So diagnostic test also fall under cross-sectional study. Okay, number 12, the researcher wants to determine the mean difference of anxiety score among secondary school teachers in Malaysia. Okay, you are interested to know the mean difference of anxiety score. So these are the variables. So what say design is this? What say design? Yes, anyone? What say design? Somebody answer case control. Anxiety. Anxiety, is it rare? It's a common, right? So you just go and you go to the school teacher, secondary school teacher, and then you take all these variable. That means you see the location, job category, the ethnic, number of years. So cross-sectional study only. Okay, cross-sectional study only. Okay, 13, an exposure in the community was considered to develop a disease. Okay, a group of researchers identifies the exposed and unexposed group to determine the development of disease over 10 years. What study design? Look at the key point there. Yes, this is over 10 years, so clear cut. It is a prospective cohort study. Okay, next one, a family medicine physician wishes to identify the prognostic factors of patient diagnosed with malaria. Okay, outcome is time to develop relapse of malaria. So this is the independent variable. Patients were randomized into 3 groups based on types of treatment. So what's the design? Yes, why RCT? Because of the randomized, right? The keyword is randomized here. Okay, last one I think. Psychiatrists want to identify contributing factors towards suicidal tendency score. So this is independent variables. So what is the study design? Contributing factors towards suicidal tendency score. How shall you design? You just want to know what are the factors towards the suicidal tendency score. Yes, this is an observational study, correct? So what type of observational study? What type of observation? Yes, it's cross-sectional study only. Okay. Case control, suicide. Those who commit suicide is common, right? Right? So it's not a rare health situation. Okay, so it's just a cross-sectional study. Okay, so that's all. Okay, so that's all. We finished already our on the study design. Any question? Can you understand?
Can so far, Doctor.
Okay, good. All right. So, insyaAllah, our next lecture will be hypothesis formulation and testing and also estimation. Okay? Okay, if no question, then that's all for today. InsyaAllah, I'll see you again next week.
Thank you, Doctor.
Okay, welcome.
Thank you, Doctor.
Welcome.
Thank you, Doctor. Assalamualaikum.
Assalamualaikum.